This is Edmond De Leon, your presenter for this day, together with my group mates, under the advisory of Mr. Michael Luisi Salis. Today, we will be presenting our research study entitled Sexual Practices, HIV Awareness and Perceived Risks Among Young Self-Identified LGBTs in Angeles City. According to HIV.gov 2020, the human immunodeficiency virus, or HIV, is a virus that attacks the cells and helps the body fight infection, making it more susceptible to other infections and illnesses. It spreads through contact with certain body fluids of an individual with HIV, most frequently during unprotected sex. Republic Act Number 11166, Discrimination Policies and Practices Based on HIV Status, Sex, Gender, Sexual Orientation, Gender Identity and Expression, Age, Economic Status, Disability, and Ethnicity obstruct the enjoyment of basic human rights and freedom guaranteed by the Constitution and deem harmful to the national interest by Lawful.net 2018. In March 2021, there were 43 newly reported cases among adolescents with HIV. 26% or 11 were 15 to 17 years old, and 74% or 32 were 18 to 19 years old. All adolescents were infected through sexual contact, 5 male to female sex, 30 male to male sex, 8 with both males and females. Further, in the past 5 years since 2019, there was an increase of cases among groups of 15 to 17 and 18 to 19. In 2019, there were 120 diagnosed among 15 to 17 years old. This was 6 times higher than 2014 or 21, which 18 to 19 years old were 3 times higher in the comparison to the same reporting period of 2019 or 417 and 2014 with 174, according to DOH.gov 2021. Subtopic 1, Factors Influencing HIV Awareness Among High School Students. For the subtopic 2, Factors Influencing the HIV Perceived Risk Among High School Students. Subtopic 3, Relationship of HIV Awareness and Perceived Risk. Subtopic 4, HIV Awareness and Perceived Risk during the pandemic. The general aim of this study is to describe the relationship of awareness and perceived risk of HIV among young LGBTs in Angeles City. Furthermore, the following specific questions will be answered. To facilitate a focused analysis of gathered data, the following hypotheses are presented. There is a significant relationship between the awareness of HIV to the perceived risk among young LGBTs in Angeles City. The relationship between the awareness of HIV to the perceived risk among LGBT is influenced by the demographic and sexuality profiles. As shown in the diagram above, the conceptual framework demographic profile consists of gender, age, education level, and economic status. The next domain includes sexual history, such as early sexual debut, multiple sexual partners, and inconsistent condom use can greatly contribute to the perceived risk of contracting HIV. Furthermore, beliefs about the personal risk for HIV and lack of proper awareness of HIV infection are central to the understanding of what motivates people to engage in behaviors that might increase or reduce the perceived risk of HIV infection. Perceived risk of contracting HIV people having unprotected sex based on their knowledge, education, negative perception due to lack of knowledge, awareness, and having certain jobs that influence sexual behavior. This research is designed as quantitative, descriptive correlational research. Data gathering was made face-to-face and online survey through purposive sampling. First, must be 16 years old and above. Second, must be a senior high school grade 11 and 12 LGBT youth in Angeles City. Third, must be self-admitted member of the community. And last, must be a young LGBTs of Angeles City. For the data analysis, descriptive to illustrate the frequency, percentage, and mean of factual data. Inferential to measure the relationship's influence or significance between HIV awareness and perceived risk. A statistical method for determining the relationship between variables is the person-product moment correlation coefficient, usually referred to as person correlation coefficient R. It reveals the degree to which the independent and dependent variables are connected by Chow 2017. For the demographic profile, ages 17 to 19 got 59.18%, 19.19% for ages 20 to 23, and 20.92% for ages ranging from 23 to 25. When it comes into gender, 46.43% are bisexual, 25.05% are gay, 22.07% are lesbian, and 5.36% are transgender. Moving forward to the type of school, 38.08% are from public school, 39.95% are from private schools, and 25.26% are currently not studying. The researchers have a total of 9 barangays categorized into Rural Health Unit, or RHU. Under RHU2 are barangays from Anunas, Coayan, Lourdes Northwest, and Pampang, with percentage of 24.49%. RHU3 rather are barangays from Agapito del Rosario, Clara M. Recta, Malabañas, Virgen de los Remedios, with a percentage of 6.63%. RHU4 is the barangay from Amsik with a percentage of 2.81%, and the respondents who have the highest percentage are labeled as NA, or respondents from local schools with a percentage of 0.07%. Moreover, respondents who are single have the highest percentage of 70.92%, 26.02% are in relationship, 2.81% are in common law partnership, and 0.26% are married. Moving forward with the strand, 15.31% are from ABM, 6.12% are from gas, 14.54% are from UMS, 14.80% are from STEM, 19.13% are from TVL, and 0.26% are from BSN, and 29.85% are not applicable or respondents who are out of school youth. 38.78% of the respondents who have answered yes are sexually active, and 61.22% who answered no are not sexually active. Researchers found out that 14.80% of respondents met their partners through social media, 13.37% in their neighborhood, 18.16% are their classmates or schoolmates, 4.85% met their partners in bars and clubs, and 1.27% met their partners in public places, and 57.65% are NA. Out of 392 respondents, 85.20% in percentage have not been tested for HIV, while 14.80% have already been tested. Researchers found out that 12.50% engage in oral sex, 11.22% engage in penetration, 8.67% engage in mutual masturbation, 4.85% are engaged in the use of sex toys, 5.10% are engaged in virtual sex, and 57.65% answered NA. On the other hand, the researchers sought to be active in sex within months of the respondents. Most of the respondents answered no, with 63.27%, and respondents answered yes with 36.73%. Researchers figured out the respondents asking questions about sex through their family, 15.82%, 38.52% asked their friends, 25% were asked through the internet, 9.44% asked their friends, and lastly, 11.22% respondents were asking from the professionals. In this table, the researchers found out that 0.26% of the respondents have engaged in high awareness, 38.52% of the respondents have average awareness, and 61.22% have low awareness. Therefore, the mean of this table is 3.64. In this table, the researchers recognized that the highest level of perceived risk is high perceived risk that has 23.47%. The moderate perceived risk has a 14.87%, and 58.67% for the low perceived risk. Therefore, the mean of this table is 3.58. When it comes to the age of the respondents, it was revealed that respondents ages ranging from 20 to 22 years old have the highest level of awareness of HIV compared to the other respondents. Likewise, Sabaro et al. 2017 have found out that younger age groups are more likely to practice unprotected sex and have multiple sexual partners, and most young adults may be aware of HIV because of media and government programs. The young LGBT ages ranging from 23 to 25 years. Among the study participants had sexual contact, and the mean age of first sexual encounter was 17. According to CSIC 2014, despite knowing about HIV, some young LGBT engaged in risky sexual behavior. In terms of gender, the result revealed that gay respondents have the highest awareness of HIV compared to other LGBT respondents. In a similar study, it was found out that along with higher rates of transactional sex, having sex while under the influence of drugs, and higher odds of self-reported HIV seropositivity, the gay community was linked to greater pre-exposure prophylaxis or PrEP, knowledge, participation in health promotion programs in both of these behaviors by Houghton et al. 2018. Furthermore, respondents who are transgender were found out to have the highest perceived risk of getting HIV. As mentioned by the Philippine Department of Health 2017, transgender women or TW and men who have sex with men or MSM are at disproportionately higher risk of HIV infection in the Philippines, owing to factors such as inconsistent condom use, high level of sexual risk taking highlights that two-thirds new HIV infections in these age groups occurred in the youth and young adults. Focusing on the school respondents that are out of school have the high level of awareness when it comes to HIV. It was found out that many out of school youth showed awareness about HIV but low levels of contraceptive practices by Atara et al. 2018. Talking about the school, it was revealed that the respondents from public school has the highest perceived risk and engage in risky sexual behavior with a prevalence of sexual unprotected intercourse, as stated by Francis 2018, students from public schools are particularly vulnerable to HIV due to factors poverty, lack of employment opportunities, low self-esteem, and entrenched notions of gender. In relation to awareness of HIV among urban areas, it was noted that the barangays appear to have the highest level of HIV awareness. According to Oladane et al. 2017, rural areas tend to have fewer health providers and other health services than urban areas. Some areas are very remotely located and difficult to reach and without services. The respondent observed that the barangays seem to have lowest levels of perceived risk of HIV when it came to rural areas. It was specified in the study of McKinney et al. 2018 that there is a low level of HIV risk across rural areas. Regarding personal status, respondents who were in relationship demonstrated lower awareness of HIV than respondents with other personal statuses. It was clearly specified by Farthering et al. 2019 that HIV awareness in a relationship partner was insufficient, wherein it indicated that lack of communication and bringing up the subject of HIV was a barrier to raising awareness of HIV. With regards to the risk of HIV, specifically among single status respondents, it was revealed that they have a higher risk of having HIV according to Shisana et al. 2017. Individuals who are single have a 7.5 times higher chance of contracting HIV than those who are married couples. Talking about the strand of the respondents, the ABM students have the lowest awareness of HIV compared to other strands. Virtusio et al. 2020 claimed that the ABM strand has not received any education about HIV/AIDS and is either ignorant of the ways in which HIV is transmitted or has accepted historical stereotypes about the disease. ABM students are knowledgeable, but they are less aware of how it is transmitted and more conscious on treatment and prevention. Meanwhile, the respondents under the ABM strand have the highest perceived risk of HIV. Moreover, it was stated by Villaron et al. 2019 that ABM students generally are not well informed of the virus and the mode of transmission that makes them susceptible to the disease. Delivery mechanism to sex education and HIV education is largely ignored and downplayed by the ABM strand because they are not inclined with health-related topics. People who did not engage in sexual activity felt like they had little to no danger of getting HIV. However, according to HIV.gov 2018, it is also possible for an individual to be infected with the disease, not only by just having sex, but by also direct contact with certain body fluids from a person with HIV who has a detectable viral load. Moreover, the respondents who identify themselves as sexually active have the highest perceived risk of contracting HIV. According to Kamine et al. 2022, having an HIV positive partner or a partner with unknown status, as well as having a sexually transmitted infection, were factors associated with both HIV infection and high risk perception. The majority of young LGBT were sexually active. From the forms of their sexual experiences, it is obvious that the majority did perform risky sexual practices in terms of HIV contamination. The respondents' knowledge on HIV is also the lowest among those who met their sexual partners from public places. Grove et al. 2017 found out that over half of men who did not reveal their own HIV status to their most recent sex partner, and that men who met new partners in parks, the great outdoors, and other public areas were more likely to report multiple partner intercourse. Talking about meeting their sexual partners, the lowest perceived risk of meeting their partners in bars and clubs, a possible justification for this is when respondents highlighted that their preference of meeting potential sexual partners in bars and clubs wherein their mentors or bartenders could help them identify who is safe to have sex with by wide Hugto et al. 2017. Those who have not yet undergo HIV testing recorded low HIV awareness. It was stated by Blas M. et al. 2018, lack of knowledge about HIV infection, such as the method of transmission and testing, is a significant predictor of HIV testing uptake. All preventive interventions to lower HIV transmissions can fail if they are not implemented properly. Both at the individual and community levels, the chance to request a diagnostic HIV test may also be lost due to ignorance about the circumstances of potential HIV exposure, which ultimately result in a late presentation for HIV care. When asked about HIV testing, those who underwent HIV testing have lower perceived risk. This was explained by Frock et al. 2018, stating that HIV testing has been noted to be among important strategies to prevent HIV transmission and acquisition. Further, getting tested and treated for HIV can lower the chances of getting or transmitting HIV and other STDs. In terms of sexual activities, respondents who answered mutual masturbation have the highest awareness that there is no risk of transmitting or receiving any sexual transmitted disease lined with HIV. According to Herzog 2019, mutual or group masturbation is an incredibly safe sexual practice that provides a ton of opportunity for pleasure and exploration. Partners usually don't make physical contact with each other during mutual masturbation, even with partner-assisted masturbation. In terms of sexual activities, the results reveal that using sex toys have the lowest risk of HIV to the other sexual activities for LGBT youth. According to Roger Pedopi 2019, that if sex toys are not shared and used with new clean condoms for each partner or properly clean, there is zero HIV transmission risk attached to using sex toys. In terms of 6-month sexual control, it was revealed that both yes and no answers are equal. The respondents who answered yes and no have the knowledge of awareness of HIV. First and foremost, they had no idea about HIV according to Same Almastri 2019. But declining HIV-1 incidence rates have no been uniform across all religions and risk groups, highlighting the importance of different transmission routes and risk behaviors in facilitating HIV-1 transmission. To explain the awareness of HIV with regards to whom the respondents asked questions about sex, it was unveiled that participants give queries seek for advice about sex to professional to be aware of HIV. Furthermore, it was stated by Sir J.A. et al. 2017 that people, especially individuals both genders, refer to and contact medical professionals to seek information, particularly about HIV as well as other disease, wherein it helps them to be educated on health information concerning on how to mitigate communicable diseases. Considering the question about sex, respondents who have or who were in intimate relationship and who asked and discussed the topic of sex with their partners was revealed to have a reduced chance of contracting HIV. Furthermore, Gosse et al. 2018 indicated that the risk of HIV was low in intimate couples, wherein it shows that safe sex conversation between partners was a beneficial approach to mitigate HIV. It is also indicated that training on how to acquire safer sex communication skills lead to improvement in how to engage in safer sex discussion. It is observable from the table 6 that the mean score for international AIDS awareness is 2.36, which is described as low awareness. Meanwhile, the mean score for the perceived risk of contracting HIV is 24.8, which is described as a moderate risk. Furthermore, the correlation coefficient was obtained using the Pearson product moment correlation and was a value of negative 0.05%, which is described as a very low negative correlation. However, a test of significance was conducted and the value is negative 0.9887, which was lower than the critical value or it falls under the non-rejection region. Hence, there is insufficient evidence to reject the null hypothesis. That is, there is no significant relationship between awareness and perceived risk among respondents. We will now proceed to the implications of the study. Based on the results of this study, the researchers would like to emphasize the following propositions within the areas of awareness and perceived risk of HIV. The findings of this study did serve as a basis for education on HIV among LGBT. It may use findings to formulate and implement its awareness of HIV. It relates to the well-being of youth regarding their physical, emotional, social, and mental health in today's world, more especially in the context of this epidemic. The important implications of this study derives from the findings on the uniqueness of the knowledge and information work. In short term, this include the adoption of events to ensure the safe of youth and students' awareness and perceived risk of HIV among LGBT youth in Angeles City. Limitations. In the aspect of gathering data due to COVID-19 pandemic, intimate physical contact is still absolutely forbidden and necessary to uphold the social distance regulation in order to prevent the sudden surge of cases. The researchers utilized an online survey questionnaire, thus, it can affect the internet connection of the participants while answering the survey. Participants are only available for a limited time. Such barriers may limit the amount of time available to answer the survey questionnaire. The researchers don't have direct interactions with the participants, and it doesn't have the assurance that the participants really answered the survey questionnaire fully on their own. With that, researchers decided to gather data and information by conducting face-to-face surveys in their barangays and schools. The researchers felt disappointed in the reason for rejection. They wasted time just because it was too much time. Some don't want to be disturbed during their work hours or etc. Through this strategy, the researchers will be able to know the awareness of HIV and perceived risk to the LGBT youth in Angeles City. Future researchers should modify their data collection methods to indicate these gaps. For the conclusion, the purpose of this study is to find out how high the percentage of awareness and perceived risk among young people in Angeles City. First, the purpose of this study is to describe the relationship between awareness and perceived risk of HIV among the young LGBTs in Angeles City. Thus, the following conclusion is offered. Second, more likely the following will have higher awareness: 20 to 22 years old, gay, out of school, youth, lives in Malabañas, living in common law, studies STEM, meet sexual partners in bars and clubs, underwent HIV testing, practicing mutual masturbation, ask the professionals and intimate partners about HIV. The following could possibly have high perceived risk: 23 to 25 years old, transgender, studies in public school, lives in Quayan, single, studies ABM, not sexually active, not meeting sexual partners, not tested for HIV, not yet engaged in sexual activity, did not practice sexual control within 6 months, and those who asked the family about HIV. Statistically, there is a very low negative correlation between awareness and perceived risk. The lack of significant relationship might be caused by factors identified by the researchers, such as one, the respondents filtering their answers because of the sensitivity of the topic. Two, some respondents did not answer the question seriously. The following lists the researchers' recommendations to stakeholders on how to find revealed studies that may be helpful to their field. One, for the future researchers may conduct and replicate the study or may use it as a reference in the future to further validate the results. Two, schools administrators and curriculum developers can help in educating the children and the youth by creating programs that will give them better chance to protect themselves and to have awareness to the perceived risk of HIV. Proposed program project output. The proposed program or project output entitled Let's End This, Get Tested, and Know Your Status to End the HIV Epidemic. With that, this program will be beneficial to LGBTs in Angeles City, whereas by the end of the program, participants will be able to create a culture of awareness and acceptance at the same time to have community involvement in prevention and spreading awareness about HIV. Participants will be able to raise awareness and create more openness about the disease and to make communities more supportive of people living with HIV. To create openness about HIV and speaking it about publicly, supporting people who are open and encourage voluntary testing. The researchers would like to express their sincerest appreciation to the deepest gratitude for the following persons. The following slides contain the references that the researchers used. Thank you so much for listening and be safe.